This is our last session of the day before we have our networking meeting. And this is the policy recommendations and strategy number 2. So we have 4 speakers today: Jason Thompson from Melbourne School of Design, Stephen Duckett from Grattan Institute, Meir Rubin from Kohelet Policy Forum, and Zacarias Bustos from Sanatorio Francés. So Jason, you have the floor now.
Great, thank you. And I've got about 20 minutes, is that right?
Yes, you do.
Yes, yep.
Great, fantastic. Thanks so much, everyone. I'm just going to share my screen. Here we go. What can people see there? Can you see the right one? Oops, sorry. Here we go. All right, thanks so much for the invitation to speak today. It's really exciting to be here. Big follower of coronavirus.org for the last 6 to 9 months. So yeah, again, thanks so much. I'm going to touch on some bit of background. I'm from the University of Melbourne in Victoria in Australia, which is the one of the southern states of Australia, where we've had some success in essentially eliminating community transmission of coronavirus through a number of different efforts that have come from different angles, I suppose. And Stephen Duckett, who's also with us in the panel today, is going to speak about some of that as well. So I'm just going to give a bit of a background about perhaps what our role was as from the university. So I just want to focus on this quickly on this quote on the left here. The COVID-19 has prompted a breathtaking mobilisation of scientists whose work might inform the decisions of individuals and professionals if only they had the information in a usable form. I think this has been said in many contexts, but I think this is particularly pertinent for what's happened with coronavirus. There's no lack of evidence around what is possible, and there's no lack of evidence about what can be done or perhaps what should be done. Often, though, the gap is in giving that to people in a form that they can use, both to wrap their heads around the complexity of coronavirus and but also in a way that they can use politically as well. Been making arguments that essentially the virus is largely a constant, except for a couple of new strains, but the virus is largely a constant, and everything else that has happened around in different countries is the variable. So the economic circumstances, the social circumstances, everything else, they're the things that we can change. So I'm going to be talking about how we've used agent-based modelling and computational social science to bring all of those sorts of elements together to provide evidence for policymakers that enable them to make decisions, enable them to make better decisions. So what we've been able to achieve here in Victoria is quite significant, I suppose, on a global scale. In 2020, we demonstrated how using the study of artificial societies can be used to assist policymakers think through some of the toughest decisions of their lives, that they describe as the toughest decisions of their lives. We're able to combine and convert available data sources and information into robust evidence that was convincing and enabled government to act on it successfully. We were able to provide public health officials with evidence that competed on equal terms with other evidence that was being supplied by other parts of government that wasn't convinced by the public health arguments. And it's arguable that Victoria is probably now eliminated, and we've had 21 days again since a second little outbreak, but we've eliminated arguably twice now local transmission of COVID-19, when I'm sure we've heard many of the arguments that it's impossible to eliminate transmission of COVID, and that living with COVID is the only option. And this worked, we think, because our research had legitimacy in the eyes of government decision makers. We had an interdisciplinary team. We had good people within government, some of whom were ex-Grattan Institute people. We had an iterative and engaged policy, engaged development process, and we made our models explicitly policy relevant. There have been lots of epidemiological models out there, lots of that have been very, well, epidemiological models, but our models were very, very policy relevant models. They were all about what effects on the epidemic curve would you see given certain policy approaches. And so we've now tested this in the real world. It works and has delivered significant public and health and economic benefit. Latest figures are the Victorian economy, which is our state economy, is projected to grow by 5% next year. And Victoria, as are other states, is now preciously guarding its COVID-free status. This is something that the state government does not want to give up easily. So they're the I suppose the big things I wanted people to sort of understand. We had a very people contributing to this work. There's an interdisciplinary team, and it was a set of international collaborators. Michael Baker, who I know is on one of the other sessions, also contributed to this work from the University of Otago. I suppose a little bit of background. Our modelling, we're doing a lot of agent-based modelling, and without thinking about it too much, our early epidemic models that we were producing back in March and April sort of naturally suggested that implementing a range of social distancing measures, mask wearing, tracking and tracing, and case isolation could effectively eliminate COVID-19 in Victoria, in Australia and New Zealand. And we didn't think that this was anyway interesting. We just thought that this was what you would do. And then we started seeing some of the epidemiological models that were guiding the Australian government, which were really saying it wasn't possible to eliminate at all. And really what we needed to do was to flatten the curve. And flattening the curve, great, but there was no option at all in those epidemiological models that you could actually eliminate community transmission. And we thought this was odd. So Australia had not expressly pursued an elimination strategy, unlike New Zealand, which pivoted to an elimination strategy. And Australia is theoretically still pursuing a zero community transmission strategy under an aggressive suppression strategy. So they don't want to say elimination, they say zero community transmission. And there's sort of the public statements around this is that suppression or the elimination is too costly and the cost would be too high economically, despite the fact that it's kind of been done. We considered that this was potentially due to the narrow modelling advice that government received, especially early on, which was that elimination wasn't possible. And until this point, until what had happened in Victoria, essentially, traditional epidemiological modelling had been triumphant over computational social scientific methods or methods that looked at things from a complexity science perspective, which you could argue is reasonable, and it's a longer tradition of things, but we thought they were limiting in terms of what was available for policymakers. So we began working on an agent-based model in early March, tuned to Australian and New Zealand circumstances. The idea of the model was to take into account not only the health effects, but also the economic effects and political and public will to comply with social measures as well. And we did this in response to these very siloed models that only were looking at disease transmission or only looking at the economic impacts of the pandemic. Our models handle at various levels of fidelity, basic information spread, policy interventions such as school closures, tracking and tracing apps, mask wearing and efficacy, social distancing, essential workers, working from home capacity, ICU capacity, infection rates, mobility, household structures, all sorts of things. And now they also take into account different vaccination strategies and various strains that might be in the community as well. These models were built to be very high level, computationally cheap, and very flexible. We wanted them to be available to anyone else around the world who wanted to take the model and adapt it for their own circumstances. It's available on GitHub. There's about 12,000 words worth of technical documentation that come along with the model as well, which I attempt to keep up with every time I change something. They differ from most other economic models, and they're policy models, and I emphasised this earlier. They're especially made for decision support tools for response and recovery. They combine spatial, behavioural, biological, economic and psychological elements, and we work very closely with the policymakers to iterate them and to tune them to local circumstances. We've taken these models and we've also applied them in other areas as well, such as Armenia and Pakistan recently, and they're scalable. So they start off at about 2,500 people, and they can scale up to any order of magnitude above that, up to, we've had them up to 250 million people when we've thought about Pakistan. They've got a strong track record of performance. We're able to predict within about a week of New Zealand's elimination when that might occur. We also suggested that Australia was likely to see a second wave. Unfortunately, it happened in our home city of Melbourne, and we were able to predict reasonably accurately within about a day or so when Victoria might achieve elimination as well. And we continue to refine the models and continue to iterate them. For Victoria, I just want to sort of show you very quickly about how it happened in Victoria. We were particularly interested in Victoria wanted to sort of give certainty for the next sort of few months. So a lot of the epidemiological models were able to tell Victoria what was going to happen in the next 6 days. That wasn't really what government was looking for. They were looking for, okay, well, when could we think about returning people to school? When could we think about opening workplaces up again? What would our Christmas look like? So we were asked to model how to release restrictions, when was going to be safe to release all of these restrictions, because Victoria had been in a hard, what we called a level 4 lockdown, where there were, quite extreme restrictions on movement and ability to access, workplaces and schools. No one was, everything was essentially shut down in that level 4. So as we came out of it, we were still at about 150 cases a day, and we were asked to project when it is that we might get to less than 5 cases a day, and under circumstances under which that might occur. And we also were asked to look at the risk of entering back into a third wave, which no one wanted to do, and to suggest what level of cases we would need to get down to in order to reduce the likelihood that we would enter into the oscillation pattern that we're seeing so far in so many places around the world. The model has a set of policy triggers that we go through, levels 1 to 4. This is, I suppose, a small illustration of policy triggers that are happening over time here. If you can imagine on the scale on the left, these are all individual runs of the model. We have level 4, level 3, level 2, level 1. In some of these examples here, we have a steady decline from level 4 to level 1, and we stay at level 1 or level 0. And in other models, say on the right-hand side, we have an oscillation pattern where we're in and out of restrictions, and this sort of thing that we wanted to avoid. And these are the sorts of results that we sort of produce out of the model. They're stochastic models. We can sort of suggest when it is that we might enter or exit into various stages based on the restrictions and the behaviour of the virus at any particular time. I'm just looking at the time, and I want to give people time for questions. So I'm just going to sort of show you some of the government information that came out. Again, this was really a decision support tool for government to help them make better decisions. When they announced this roadmap on the 6th of September, it came along with a lot of, I suppose, information alongside it, which was about the justification of why it is that they had chosen to ease restrictions and chosen in the roadmap in the way in which they had. And a lot of that made reference to the work that we had done as evidence for why it was that Victoria was going to go down this path. So in this slide here, the government was really keen to talk about the risk associated with opening up too early, the risk associated with going back into a level 3 or greater style of lockdown if we didn't get cases down low enough before we eased restrictions again. And again, they were really keen to emphasise that they did not want to go into this oscillation pattern of easing restrictions and then having to go back into them again, as we see across the world. And again, they didn't really want to put this slide in there because they said it was too complicated, but we were really sort of keen to make sure that it was in there because we wanted to show that this was not, sort of a simple, linear kind of process. There was still risk associated with every single scenario. Fortunately, by luck or good design, we estimated that on the 26th of October that we would reach less than 5 cases a day in Victoria, and that would enable us to ease to stage 2. I think it was released on the 25th, the day before. It was that 5 case scenario was reached on about the 25th of October. So pretty much in line with the average of what it is that we sort of said. But you can see there's so much variability even within our estimates. So it probably it made our results look very good, I would have to say. And again, just sort of pointing out here, we're now using it to sort of think about what the likelihood of restrictions given new strains of the virus might be, and or new strains of the virus plus vaccines of various levels of efficacy. So we can sort of see on the right-hand side at the top where we have no vaccine, and we've got a UK style of strain, and that's much suppressed in the bottom right-hand panel where we have a vaccine, even though we have a highly contagious variant. And this is for the less efficacious vaccine condition here. So we can use the model to compare all of these sorts of scenarios. So that's all I wanted to run through. Hope I've left a couple of minutes for questions. I'm happy to take any questions from anyone. Thanks so much.
Thank you, Jason. Yeah, so we literally have just a couple of minutes for questions. If anyone has any quick questions for Jason, you put it in the chat.
Jason, I'm sorry, I have a question. I didn't see who you were with. Are you with the government? Because I mean, I'm super excited that you've been doing the agent-based modeling and to doing the reopening strategies, and I don't understand why more places aren't taking all those things into account the way this is done.
Yeah, so no, I work for the University of Melbourne, and funnily enough, I work in the School of Architecture, Building and Planning, and so I don't. I'm not from the School of Medicine, even though my background's in health. My PhD was in medicine, and the other part of my life is in clinical psych. So I suppose I've spent most of my life modelling health systems, especially insurance systems, and health policy and insurance systems. So I'm not from the government, but I think we were very lucky in that we had some very friendly people within government who understood these sorts of models and had some experience with them and were very tenacious and were, sort of right people, right time. We can't discount the influence of those people inside government who helped sort of shepherd a lot of this work through.
Yeah, I've always thought that, you don't give it to the health people to solve, you give it to the mathematicians, the operations research, the agent-based modelers to solve. So I was super excited to see your talk, and just, yeah, I'm very excited by it. Thank you for talking.
No problem.
Okay, thank you, Jason. Our next speaker is Stephen Duckett from Grattan Institute, and his talk is Zero is Possible, Lessons from Australia. Stephen, go ahead.
You're on mute, Stephen.
Okay, when I tried to unmute, it said that I wasn't allowed. Anyway, so I'll just start again. I'm from Grattan Institute, which is an independent public policy think tank that contributes to the debate and also provides internal advice. During 2020, we produced 2 reports, which are shown there on the introductory slide. The first one in about June and the second one in September. As with Jason, we developed our own agent-based model to inform our policy. And it is that model which really helped to shape our very strong advocacy for a zero target. And I think we were influential in getting government to actually, state government to actually go with that. So, just to give you an understanding, Victoria is the state where I'm in. The heavy black line there is our experience. You'll see that we hit over 500 new daily cases following a failure of hotel quarantine. And then there were strict lockdowns that got us to 0. Importantly, our level in that August sort of period was similar to many other countries. And so our experience shows if you're at a level like that, you can get to 0. Now, of course, some of those other countries have got much worse since then. As a result of lockdown, the economy slowed down significantly, but it has bounced back again, as shown in that slide. Importantly, I've got 4 points on the experience. The consumer response was ahead of government. That is, people started to reduce their activity. They're going to work, driving, walking, and so on before government implemented restrictions. And so what I take from that is that there was a strong social license from the public for government to act. That is, there was strong support for government to do something about it. And I think it was shaped by seeing what was happening in Italy with the health system overwhelmed, significant deaths and so on. And so there was strong community fear about COVID, which led to strong support for some of the fairly stringent measures that were implemented. And that's held up in most states during the pandemic. You'll see that in Victoria, which had the most stringent lockdown, the public support for the government dropped slightly below 50%, but it has recovered to above 50% since then. The important issue, one of the critical factors about Australia is that the political spectrum about views about how you should respond to COVID is limited. That is, the spectrum is from those who believe you should suppress the pandemic to ensure the health system can cope, to those who go for elimination. There are very, very few COVID deniers who are active in the country. So there are some in the media and a couple of politicians, but it is unlike the United States, which is riddled with COVID deniers. In Australia, on the other hand, most state governments are pursuing elimination as a strategy. The federal government is more moderate about its approach in terms of pursuing elimination. It talks about, as Jason said, going to using suppression with a target of 0. Importantly, both the suppression and elimination advocates emphasise the importance of evidence And as you know, the evidence developed during the course of the pandemic. This is from the BMJ, published in the middle of the year. And it was also, we also used this to promote the evidence about what government should do. So what worked? The first thing is strict external border control. So you can only travel out of Australia with a approval to travel out, and that approval is generally not given if you intend returning within 3 months. There is very strict arrival controls, just been even tightened. That is, the number of people who can fly into the country is strictly limited. And so there are lots of Australians stranded overseas. Airlines have basically are filling their business class and first class seats, but have just a handful of economy class seats. When you arrive, you have to go into quarantine for 2 weeks. There's also been internal border controls. That is, states which had no COVID closed their borders to other states, and that bounces around, I won't say on a weekly basis, but if there's ever an outbreak, there's always reimposition of internal border controls. There was some within state border controls. Metropolitan Melbourne controlled against the rest of the state, which had lower COVID. That worked. Within city border controls were also tried. In Victoria, that didn't work, but they did work in New South Wales because there was a peninsula, which is colloquially referred to as the Insular Peninsula, and there was that border control, green zone, red zone, actually did work. There are other policies implemented simultaneously, like telehealth, which worked. Very high level of acceptance of masks indoors and outdoors. They were mandated in Victoria, but not in New South Wales. And I think that was a mistake in New South Wales. There was free testing right from the start, unlike in the United States. And there was also public income support if you couldn't get income support from work while you're waiting test results. What was really important was the clarity of the objective. As we were coming out of COVID, of the second wave pandemic in Victoria, the government made absolutely explicit what its objective was, namely to get to zero, and the staging, how the restrictions would be lifted as we progressed towards zero. What didn't work, as I said, we had failures of hotel quarantine, which continue, and in fact, to be expected. We had some lockdowns of individual public housing estates, which just failed to recognise the multicultural nature of Australian society, and that didn't work very well at all. Commonwealth state cooperation was variable because the states are responsible for public health. They were calling the shots. The Commonwealth felt like it needed to be in the game and ran interference and criticised the states in a number of cases. So, as I said, that's overall how it went. I think we were successful. We've got to zero. We're more or less staying that. So that's where we are. Thanks.
Thank you, Stephen. Does anyone have any questions for Stephen? Or actually, Derek does right here. Derek would be interested to hear Jason's or Stephen's thoughts on the Bahamas. It seems like they've had some success in getting a bit more international travel by reducing quarantines and ramping up testing travelers. They got rid of quarantines around November, still seeing low case numbers now, not zero, but most islands are at zero. You guys have any thoughts for Derek? It's okay, Derek.
Basically, all I'll say is that we still have arrivals who test positive on arrival. We've got, I think, a relatively old-fashioned approach to quarantine, that it is hotel-based quarantine rather than self-isolation with electronic controls, which you can now do. So I think we're going to retain hotel quarantine, I think, for the foreseeable future until there's a rigorous alternative proposed, because the costs of rapid expansion of coronavirus in the economy is pretty high.
And a follow-up question, what do Australians think about what is going on in North America and Europe?
Well, with respect to the United States, we weep, of course. And, you know, partly the Trump legacy of the COVID denying approach, which we didn't, as I said, we didn't see here. The UK, where we see more, is of course quite interesting. I think they're the first country now with 100,000. You know, they've just got so many deaths and so many new daily cases. Again, I think because of initial poor response by government. But we watch with interest what is happening overseas, and we also are amazed that people say zero is not possible. There was some discussion, as Jason said right at the start. The initial government modelling just didn't assume there was possible to get to zero. It just was not on the agenda. The epidemiologists who were asked to do it didn't even contemplate it. And, you know, when going back, it's a different world back in March, because, you know, there was in the national pandemic, the Commonwealth pandemic plan, there was no contemplation of lockdowns and restrictions. And so that just wasn't contemplated. So there are a whole lot of stuff that just wasn't there that is now part of what we expect.
Thank you. Any more questions for Stephen? We've got a few more minutes of his time.
The only interesting, the most interesting thing is the vaccine. So there's we haven't started the vaccine rollout here. Because we're at zero cases, we don't really need the vaccine. The issue is whether we think the vaccine is not only going to reduce the severity of infections if you get infected, which is what the clinical trial endpoints have been, but also whether the vaccine will inhibit transmission. And that there are hints that this is the case, but it may not be the case. And so the politicians are talking up an assumption of herd immunity with vaccination, but whether this actually occurs is going to be an interesting question.
Oh, Derek had another good one. Do you guys have any ideas of green zone travel networks, for instance, between Australia to New Zealand?
We have green zones within Australia. As I said, we have state border controls. I've got a holiday booked for New South Wales for a couple of weeks' time, and I've got no idea whether that will go ahead or not. There's also we used to have a partial green zone travel bubble as travel bubble is what it's called, with New Zealand, but that was suspended when New Zealand had an outbreak. I think the outbreak is under control, so that we do have those travel bubbles. The issue of Ireland versus Northern Ireland is really, really complex because of the complexities of the border and the history in those two countries.
Here's another question. If there are different levels of compliance and different approaches between each country, how long do you think it will take for COVID to be completely under control on a global level? Also, what about access to vaccines in poor countries such as Africa, South America?
I think there are probably other people online who are way better placed to answer that than me.
I'll just add in there just a little bit of, the Australian context. There's been a lot of discussion about the states in Australia not having exactly the same policies, and there's, you know, consternation between state premiers about, you know, what's safe and what's not, and what's tolerable and what's not. In some respects, I sort of, you know, and people saying this is it's a great problem. In some respects, I think that the fact that we have a very convenient number of about 7 states and territories who are all competing to not be the state that has coronavirus has been quite a positive thing in terms of reaching zero, that there is some level of competition between the states, whether it's implicit or explicit. That becomes much, you know, I'm not sure that you see that sort of level of competition within a single country like the UK, you know, or something like that, where you have tiers, or whether you have in the US where you have so many states that it's difficult to sort of coordinate that competition. But I don't know, in the back of my mind, there's something fortuitous about having 6 or 7 states and none of them want to be the odd one out at any particular time.
That's a good point. We're getting another question about general thoughts in the public towards vaccines, but I don't know if you guys want to answer that one. That might be better for our vaccine session that we have coming up.
I think there is a little bit of vaccine hesitancy, but because we haven't started the rollout of vaccines, we don't know. The College of ONG just today said pregnant women shouldn't be vaccinated. So, you know, I'm quite sure there will be some vaccine hesitancy, but I'm just not sure the level of it.
How are restrictions expected to change upon vaccinations regarding borders?
It really depends whether the vaccine is protective for transmission as well as for symptomatic, you know, reducing likelihood of hospitalisation or death. But there's a lot of expectation that the vaccine is going to fix everything. Are
there any thoughts on vaccine passports?
There's been nothing in the public domain about that at this stage. The issue with vaccine passports is people deliberately infecting themselves. I don't think that's likely, but it is a very frustrating issue. My daughter was COVID positive, and she continues to shed, so she continues to test positive. So it is a personal issue for me.
Okay, I think we have time just for one more quick question. Are incentives to reach zero part of the agent-based modeling?
Incentives for individuals or incentives for the system in particular? I suppose, not explicitly, but we've also created models that that breed policies through machine learning methods, where we do incentivize the system to reach particular states, and then we look at the way in which the policy has reached that optimum state and the best way in which to get there, which is also a very interesting conversation, but a bit beyond what it is that we can chat here. But I'm happy to, if the questioner wants to email me, I'm happy to take it offline.
Okay, thank you. All right, it's time for us to introduce our next speaker, but thank you very much, Jason and Stephen. Our next speaker is Meir Rubin. He's coming to us as part of Kohelet Policy Forum, and his talk is on variants of hope, shaping and advancing policy in times of emergency, Israel 2020 as a test case. Meir, the floor is yours. Welcome.
Thank you very much. Hi, everybody. Thank you for having me. And so our case is unique in a way because we changed governments in the middle of the pandemic. And why the first government we had was a small transition government, very quick, very agile. The second one was the first time in the history of Israel that we had a government that was a paritatic government, means that all decisions were needed to reach to get a consensus from like a few parties that were actually fighting each other. So it's really delayed our response. So we actually had two pandemics. The pandemic during the first government, where we acted very quickly. We suppressed the virus. In the middle of May, we only had few cases every day. And then we got the second government and the second and the third wave, where in some days, in 2 days during the second wave, we actually had more people getting infected than the whole first wave combined. So just a little background. I'm a lawyer and economics. I study in Hebrew U, and I created a think tank about 10 years ago, which is called Kohelet Policy Forum. We are like Brookings or American Enterprise Institute or Heritage from the US. I have a team of 140 researchers and a budget of about $10 million a year. And we work with the government on all matters policy. And when the pandemic started, I told my team, listen, we need to save life here. Move everything you're doing aside, and let's concentrate on the pandemic, trying to give added value. So usually I have an expert for everything, but we have no experienced epidemiologist in Israel. So I was just moving everything aside and sitting and studying by myself, everything. So I started working with some ministers in the government that actually appreciated me personally. They worked with me for years, and I tried to give them real-time information. And I have a tactics that, first of all, whenever I'm saying something, it's based on a huge database. So we call it the iceberg. So politicians know that when we text them something, it's based on a very big asset. Sometimes we are writing 3 lines, but it's based on 12 pages that we keep. When they ask for more information, they can dig for more and get more. So I'm trying to create, first of all, they know that they can't trust our information. Second, we are trying to give them a goal. We call it the lighthouse. We try to tell them, listen, you want to keep your eyes on this thing, and the rest will fall in place. And I'm also trying to make them look smart. For example, I have a lot of sources, and I know during meetings, I know what questions are asked and what debates are like raging. And I'm sending some arguments to people with info that makes them really look smart. I mean, like they can compare. Somebody says, and nobody have done something like this, and you can say, no, but in Australia they did like they divided inside the med zones inside cities. It looks very smart. And once he's getting used to look smart, he doesn't want to go back to the stage where he doesn't have anything to the discussion. I also want to try sometimes to have more than one meeting with ministers. And Professor Yanir Bayam, thank you, Yanir, joined me for a few of these meetings, many actually in the last few months. And sometimes we are trying not to give all the information in the first meeting. We try to let them like digest the info we give them, and then we create an eureka moment in the second or the third meeting where they actually everything falls like in place and they understand, oh, so you mean that we need so red zones are not working, but green zones do work, and then everything changed because a person came to the conclusion by himself. So we try to use a broad range of contact points. We give personal like briefs. We write opinion for members of the Knesset, for ministers that they publish under their name in newspapers. We write posts for them. We write tweets for them, and we make all sorts of contact. And once they get used to it, again, they can't stop working with us because they have nobody in their teams that can keep up with doing this moving forward. So once they took materials from us, it's like drug addicts. They need to take our ideas because they know that we will not write something that is against what we are promoting. So if they got used to our materials, they will change the strategy simply to get more materials that will help them look smart and in shape. And of course, to do all this, we actually need to know what we are doing, and that's a pretty complicated issue when you are dealing with a 1 in 100 years pandemic. So thanks God, I found you here pretty early. So we made a strategic plan for Israel. I took the model from the UK. It didn't take long to understand that the UK doesn't know anything about how to execute, and that they choose every time they are making a knowledgeable decision, they're choosing the wrong decision. But the process was amazing. I mean, they created a national plan, they explained what they're about to do. They used a lot of science. They made many mistakes, but they were based on science and on advice that they received. And of course, they write everything in English, which helps, especially when you only need to read it and not to hear them. So we created a broad range of materials, from a strategic plan for the whole of Israel, some tactical plans for specific issues. For example, managed quarantine. We were one of the first countries in the world to actually have managed quarantine. Protocols for working places, and we updated this all the time. Again, I found Yanir Bayam to endcoronavirus.org when I looked up to find best practice protocols for working places. And in coronavirus, you have plenty of materials in many languages. So I used the materials, and then I asked Yanir permission to use it in one of our other projects, and he gave that permission. So we moved on. We also, reporters were a huge power during this pandemic, because a lot when in the academia, in epidemiologists know the language of pandemics, and politicians are too slow to learn the language of pandemics. But reporters are writing in the layman terms complicated things, and the better of them can actually they become better than the epidemiologist, because they understood the situation, the political situation, the actual situation on the ground better than most epidemiologists, but they were able to learn and use the language in the proper way. And so I try to look at the best reporters that can actually help me shape the public debate. So I had to open a Twitter account. Because I found out that all politicians and reporters and scientists in the world practically have a Twitter account. And I did the same thing that I've done with politicians, I did with reporters. I leaked, I have access to a lot of internal info from the government. Nothing of this is secret. I mean, but just to give it to only to the reporters that they like. I gave it to the reporters that I don't like, the ones that criticize bad decisions, and the ones that are writing on things that they find fit. And once the reporter got used to the fact that he have a lot of information, up-to-date information about anything, he needs me. If I call him, if I ask something, if I move a point forward, it will probably get a coverage. So I guess Yanir was a bit surprised how broad it was the coverage got in Israel when it was first introduced here. So that's the reason. They wanted to work with us. And I also had to write under my name, which I rarely done. I mean, in the 10 years I'm managing Kohelet, I almost never moved to the front, because I work with, currently I'm advising 3 contenders to be the next prime minister of Israel and the current prime minister. These people are not talking with each other. So sometimes when they get in a meeting, I brief every single one of them beforehand. I know what the other ones will say because I briefed them as well. So it's like a puppet show. They talk to each other in the room. It's actually a show. I rehearsed everything. You will say this, they will say that. And it's in the end, sometimes it's working, sometimes less. But I used to work just in the background. And during this pandemic, I had no choice but to move forward, because I needed to create credibility, and people needed to see that the advice that I'm giving is actually the right advice, and the things that I'm saying that will happen or will not happen, will happen or will not happen. And for that, I need my name to be recognized. So I opened a Twitter account under my name. I didn't use an organizational one, and I published op-eds whenever I felt like I'm ahead of everybody else and I understand the situation better, I published an op-ed stating all the basic like facts and decisions that we need to make. And it's work. And later I would just reference them. So I told you need to do this. I told you need to do that. And you see all the details. I told you need to control the borders. You see the details. I told you need zoning. You can see this. So basically now it's already pretty easy because I supported zero COVID from early on. And I took as a role model, I took Taiwan as a model. Nobody was beating me so far because Taiwan ended this pandemic, got to the vaccine with seven deaths and almost zero local transmission, no lockdowns. Nobody can beat that, right? I mean, so I was lucky. I took Taiwan as a model, seeing March, the end of March, yeah. So it was actually, it worked. I also, you never work in a vacuum. And many politicians have many advisors. So after a while, you feel resistance. You're talking to somebody, Yanir and myself are talking to ministers. As the ministers were like convinced, they asked many questions. And then they moved on and did something else. And when something like this happened, you know that this person is getting advice from other people as well. So I did some field work to recognize who are these people. I found them for the most critical ministers, and I took them as a project. I created a group for them. I leaked information to them. I gave them like personal briefings as well. And this way, in the critical moments when I needed them to support, for example, school closures, when we had the British variant, I was able to create such pressure on them, telling them like, listen, I know that you are wrong. You know that I was right so up till now. And I'm going to publish this, that this was a dilemma, that was your advice, and that this is wrong. And in a week, 2 weeks, 3 weeks, everybody will be able to see that this is absolutely wrong. And I managed to move them to change their opinions, and then the ministers changed their opinion. Just yesterday, the Minister of Education in Israel, a former a general, and one that said that I'm brave enough to send kids to school even during a pandemic. He actually said that. It's a fight and we will win this fight. I mean, we got like over 10,000 kids getting infected in the last a week, in the last 7 weeks. So I guess this kind of fight didn't work so well. I got him to change his mind because I changed his advisor's mind, and then he had no backup anymore. Nobody backed like his position. We also had a project for the general population. It's called Muki Bar Chosan. It's a puppet, and it's doing short movies. It got Instagram. It's got a Facebook page. It's got Twitter. It got everything, and of course TikTok and everything else. And he's creating all sorts of materials. He's interviewing reporters, politicians, just people on the street. He was the first one in Israel. He warned people in Israel that we may enter a lockdown way before anybody in the government even considered a lockdown. He actually told people, get ready that you will be ordered to stay at home for at least 2 weeks without any contact with the outside. And that was really mad. It took us another 2 weeks to get there, and only 3 days before we actually entered lockdown, I managed to convince the first ministers that that we will actually need one. So I also am the secretary of the Civil Corona Cabinet. We created this for a minister that after the election moved to the Minister of Defense, who was Minister of Defense during the first wave in Israel, and did an amazing job. So when he moved to opposition after the elections, we created a Civil Corona Cabinet to push agenda from the opposition. So we took all of his advisors from the time that he was a Minister of Defense. They were shy to tell him, listen, now that you are in opposition, we don't want to give you advice anymore. So we just we picked them all up and we created a group, and like a mixed political civil agenda group. And it worked amazingly because it was a pretty strong team, and ones that already worked together during the first wave. And we managed to convince the government to do many good things, even during the second wave from the opposition. I'm also an official advisor to the Minister of Internal Defense of the police on anything Corona. So it's a source for all of the. This way, I can read all of the classified information. I can read all of the internal protocols. Of course, I'm not leaking these materials, but the knowledge helped me a lot to understand who says what when, and then to realize the pressure point. We also created a grassroots movement. It's called pro-life, or like it's complicated to translate exactly, but it's people that are promoting like livelihood during a pandemic. What we did, we created a program for municipalities that helps them find volunteers, get them ready, create materials for them, and helps them actually achieve the goals to connecting them to other municipalities and learning from each other. So we invested in this, I think, $20,000 or $30,000, and we managed to reach over 1 million people in Israel with the volunteers, because we gave the municipalities doesn't need money, they doesn't need any material support, but they didn't know what exactly added values they can give the communities to volunteering, but they have everything else. So we just help them use their own resources and talk to each other, and it's worked amazingly. One more thing, the contact tracing in Israel, it was horrible. I mean, better than most countries, but still horrible, especially with the high level of infections that we got during the second and the third wave. So what we did, I told the Minister of Health that I can do better with like 2 students and 10,000 checkers than what they're doing with like millions, hundreds of millions. So they say it's impossible. So I say, I can show you. So I invested 50,000 checkers in 2 young entrepreneurs, and they created a startup of contact tracing. They created the startup of a contact tracing startup. They created movies. They created like all materials to teach people how to contact trace, and they started working. And they did a much better job than the Minister of Health. They did it voluntarily. Anybody who got infected and want to use them in the 10 hours that it took the government contact tracing people to call them, were able to do this free of charge and without giving any private information. So the government, just the talk, all of the cutting edge like technology and aspects and things that we created, just to talk everything in. Then they talk our team, then they talk everything. So we dissolved operations because we didn't need it anymore. So they stole all of the ideas, they used everything, all the methods. Okay, we also, I use a lot of like hugging and shaming during this pandemic, because when people change their mind, when people collapsed under political pressure, when people, I shame them with no like, sometimes I had to arrange for a bit like complicated things, so it to not come only from me. But I created a kind of a Pavlovic response. They knew that when they will make a bad decision, that they were able to get a better decision, they will pay for it publicly. Now, it was never explicit that it's me pushing this whole wave of dirt on them, but it was clear as the news that when I sent them a message saying that something is a very bad decision, tomorrow they will see this in a newspaper. And apparently, somehow it's worked like a miracle. So we managed to get some incredible things. First, Israel was the first country in the world to close its borders to all places. We did it even before Taiwan, okay, in March. We were almost the first country in the world to have managed quarantine for everybody, not only for people coming from overseas, but also from locals. We were one of the first countries to test everybody. No conditions. Anybody who wanted to get a test, I mean, Taiwan already did it, but very few countries, one of the first, probably first 5 in the world. We used the army early on because I was advising the Minister of Defense. So we did everything possible with the army. We did with the army. I raised awareness for long COVID from very early on. From early March, I already told the government that actually almost all of the zoonotic viruses that we know that can kill people can actually create long-term damage. So we should plan everything accordingly. We also fighted from very early with herd immunity by infection cult. I thought that it's crazy, and I'm happy to see that now almost everybody understands that. And I also managed to convince two very prominent heads of factions in the next government. We have elections soon. In about 6 weeks, we will have elections. And there is no way to create a government in Israel after the next election without one of the people that will support zero COVID in Israel. It is Naftali Bennett, who will talk in this conference. He used to be the Minister of Defense and is running to be a Prime Minister. Or Gideon Sa'ar, who used to be, and who is also running to be a Prime Minister. So either way, even if both of them lose, they're still like, they will still be like able to move the next government to the right direction. Thank you very much.
Thank you, Meir. Okay, so we won't have any time for questions, but I know there's a couple in the chat. Maybe you can reach out to them. It was Chris Miller and Derek Van Gennep. Well, I'll introduce our next speaker is Zacarias Bustos. He is from Sanatorio Francés in Cordoba, Argentina, and his talk is on transforming fear into appropriate action. Zacarias, you have the floor.
Thank you. Thank you very much. Hello, everyone. Welcome, and thank you for your time. It's a pleasure to be talking to you. I'm in Cordoba, Argentina. In case you don't know where Argentina is, I'm in South America. And actually, in my case, I am going to talk about a little bit more about something that is personal, but it's not so personal, and you will understand why. Actually, when they told me what I could talk about, I said, well, I would like to talk about transforming fear into appropriate action, you know. And let me tell you why. When this pandemic started, when it was declared as a pandemic back in March, I was working at the hospital that I ran. I am the general manager of a hospital here in Cordoba. I'm not a physician, I'm not a doctor. I have a BA in human resources, then some other studies in business administration. But then I know some things about health because I work in a hospital. So that is as far as I could go in terms of a pandemic. But when this escalated and it became a pandemic, I was really afraid. I was personally afraid because I thought, well, maybe something could happen to one member of my family. Something could happen to someone from the hospital, which is my working family. And I said, okay, I have to do something. I have to transform this fear into appropriate actions, because I realized that it was pointless just to be afraid. It was more useful for me and for other people to do something about it. So what I did is, and since we're talking about today social action, is I started gathering people to see what we could do, to see how we could help. At first, I started using my Twitter account, which only had like 10 followers. I only had like 10 followers because I didn't really use it. And I started learning. The first thing that I did was learn about this disease and something about epidemiology. And then I started getting in touch with everyone that was available. I went from Tomás Puello, which is someone you probably know. He has written a lot about this pandemic. I got in touch with Janier. I said that I would love to help in any possible way, of course, pro bono, because I already have a job. So I'm not doing this for money, of course, but I want to be helpful in some way. So we started discussing with Janier what we could do, and then I started getting in touch with governments. I got in touch with several governments from Argentina. I got in touch with the government, with the national government, then with the government of my province, which is Cordoba. And then we started having conversations. Janier was very present. He has been a terrific help for Argentina. And we really need that help. We needed that help. We still need that help, because this is a very, very difficult country to live in. So we got in touch. I created a group of journalists, scientific journalists, scientists, a lot of people that were studying this subject. And we created a group to help governments make decisions. So I had the chance to meet a lot of people. Everyone was great. Everyone was really, really, really keen and willing to help. But I would like to talk a little bit more about people, not scientists, not journalists, not people from any government, because of course they were all great, and I really admire that, and I am really grateful for the opportunity that they gave me to be in touch and to be someone of help. I could say that within a year, I have given more than 50 interviews for national television, radio, everything. I never expected this. This is not something that I was looking for, but this was the way that I found to turn my fear into actions, to be of assistance. But as I was saying before, I would like to talk a little bit more about social engagement, which is something that is very important for end coronavirus. And I think that it may be the way to start focusing on solutions. I would like to show you just a minute, if you let me. I would like to show you what we did with end coronavirus and with Nexi. And as you can see, this is my Twitter. As I was saying before, I went from having like 10 followers to having almost 2,000 followers. And I'm not talking about famous people. I'm not talking about interesting things. I'm talking about the pandemic. Anyway, people were very interested. And as you can see, this map went really viral. This map was not created by me, obviously, but this was created by the incredible guys from Nexi, from End Coronavirus. And as you can see, this is a map showing the cases in Argentina, showing green zones, yellow zones, red zones. As you can see, Argentina has struggled with this pandemic. It had better moments, it had very bad moments. Today, for example, we had like 10,000 cases. And this is in the middle of the summer. So as you can see, this is not very good because we are in the middle of the summer. We should be taking advantage of open air, and we still have a lot of cases. But what I was trying to show you is that through this map, people started getting, interested to see, okay, let's see, where do I live? Okay, so I'm in Cordoba, so let me see which are the cases in the place that I live. So I can see here, for example, that in the last 2 weeks, we had 391 cases, and now it appears to be going down. So this was really viral. This went to national television and everything, because this was a way of getting people as part of a possible solution, because people would write to me and they would say, look, my place, I think that my city is not updated, or maybe some other comments would be, look, I have some concerns about my city, what should I do? So people were starting to get into action, you know. So as I did before, as I said before, I transformed fear into action. Then I found a way to have common people, regular people, people that are not journalists or scientists. They are regular people, just like me. And they started finding ways to help. So I think that this is a major thing. I think this is very, very, very important. I think that it is also very important that we try to get this crisis or we try to prevent this health crisis, because this is a health crisis. And we have to try not to get it too political. That was a main problem that we had in Argentina. In Argentina, we have a very big division. It's like something that, like what's going on in the USA. So we had a lot of people saying, okay, this disease is terrible. And we had a lot of people saying this disease doesn't exist. That was in the very beginning of the pandemic. Now we are arguing if we should get vaccinated, because we have already started to vaccinate people here, and we are also helping with that. We are helping with logistics. We are helping with people that are, for example, engineers in logistics, and they want to help. So we are helping the government to start vaccinating people. And the main problem is that we are using the Russian vaccine. So we have a lot of people saying we shouldn't be. I mean, the people that used to say this disease is not real, now they are saying, well, this vaccine is not real. So as you can see, we have a major problem there. And I really hope that you don't get this problem in the USA or any other country. And I think, as I said before, that this is something very important. We have to try not to get this very political. We also had something very similar in the USA when people didn't want, or some people didn't want to wear masks. We had the same problem here in Argentina. So that has complicated coping or dealing with this crisis. But anyway, besides that, what I wanted to say, and this is like what I wanted to talk about, is this is why I said it was a little bit personal, but it's not that personal, because I transformed my fear into action. And I'm really happy, because it's been a year. It's been a very stressful year, but I think that we have done everything possible to help people. We are still doing it. We are now starting with the vaccination, as I said before. Since I work in a hospital, I'm already vaccinated. I already had my first dose, and I'm waiting for my second one, which is next Monday, and I'm really happy for that. This is what I wanted to talk about. Whenever you have a fear, try not just to have it as a fear. Try to see how you can get it into action to help someone. So, well, that's it. Thank you very much.
Thank you very much, Zacarias. That was very inspirational. I even have a question myself, but Derek has a question here. Is COVID considered to be airborne, quote unquote airborne in Argentina? Do most people know to ventilate, use air filters, etc.?
Well, as I said before, we are in the middle of the summer, so we are taking advantage of open air. But most of the cases that we still have are coming from people that are getting together in closed places, right? So I would say that, I mean, yes, answering Derek, my friend Derek's question, COVID is considered to be airborne, but I am I would say that not all people know. Or maybe they don't care, you know, because we have been dealing with this situation for a year now. And so maybe people do know that it is airborne, but they don't care. So it's really hard. And for example, it's really hard for the government to find ways to communicate these things. So whenever we have the chance, we talk to journalists, we talk to communicators, and we say, let's help the governments find a way to communicate these things. But I would say that even though we know that it is airborne, we may have some information in terms of how to ventilate, but I would say that since this is a country in development, we are not very familiar with air filters, with HEPA filters. Actually, that's not something that is going on right now. Probably in some buildings and some private buildings and airplanes, of course, but this is not very common for regular people. Air filters are not that common.
Okay. And vaccination requires 2 doses. Okay, I guess that's not a question. The vaccination requires 2 doses in an estimated 2 weeks, except for Johnson & Johnson.
Yes, actually, the Russian vaccination, which we are using in Argentina, we are starting with the Russian vaccine, and then we are also using the AstraZeneca Oxford vaccine, because the Oxford vaccine was from some other places. It was also done here, and now it went to Mexico to be I don't know this word in English, but they are doing the package for the vaccine. So then it's coming back to Argentina. So we are going to use several vaccines. But in terms of the period, it should be like 2 weeks, but it can go up to 21 days between the first and the second dose.
Okay. And are hospitals there being very safe in terms of preventing transmission?
Well, we have dealt with this situation. I can honestly say, from my personal opinion, that the hospital that I run is a totally different hospital that it used to be 1 year ago. We have changed everything, and I think that this is the situation for most of hospitals, even they are public or private hospitals. We do have a very strong public health system in Argentina, which is free for everyone. I mean, it's not for free. We pay it with our taxes,
Yeah.
but it's up for everyone to use it. Even people from other countries like Bolivia, Peru, they come here to use it, and we are very proud of that. But I would say that hospitals are being very safe, but you know, something very, I would say funny now, because it's been a long time, when we were starting dealing with this pandemic in the hospital that I run, we were really concerned for doctors, for nurses, for everyone that was in touch with people that were positive, right? And so we were really concerned, and we would say, well, when are we going to have the first doctor or nurse or any employee that is going to be positive? And you know what? The first case that we have positive, and that created a kind of, I wouldn't say that it was but it started getting contagious for other people that were working with him. It was someone that had been at a barbecue with friends, and one of them was positive. So as you can see, I mean, he didn't get. I'm sorry, I can't find the word in English. He didn't get infected working. He got infected at a barbecue, and then he infected some of his coworkers.
Oh, yeah.
Because they were not using, they were not wearing appropriately what they were supposed to be wearing. And of course, we couldn't be controlling. We have more than 300 employees, so we cannot be with all of them all the time to see if they're wearing what they should be wearing. But well, that was the only experience. I would say that now 80–90% of the positive cases in Argentina are coming from people that are living in the same household.
And what percentage of the population is open to taking the vaccine? Like, do most people want to get it, or is it more like most people don't want to get it?
Actually, the last poll that I had the chance to look at was here in Cordoba, and it was in accordance to, it was with the numbers that are showing more or less in the country, and I would say globally. It was about 60% of the population. They were considering to get vaccinated, which is not a very good number, but it could be worse. I mean, it could be worse.
Yeah. Someone asks, your country presently has a special link to the Vatican. Has there been an attempt by the church to unify the population behind a single public health agenda?
Well, this is another very political subject, because actually we do have a very special link to the Vatican because the Pope is Argentinian. But a lot of people doesn't like what the Pope thinks in terms of politics. So we also have a lot of people saying, okay, whatever the Pope says, we should do the opposite. So
Oh boy.
yeah, so that wasn't possible. I mean, it wasn't possible for the church to be of, I would say, respectfully. The church hasn't been very helpful in this situation. I mean, of course, for people who believe and everything, probably it has. But in terms of public health agenda, they haven't had a very proactive position, no.
Okay, well, thank you very much, Zacarias. That was very interesting. Thank you to all our speakers. I just want to remind everyone that I have now I'm struggling. Slideshow play. Here we go. So I just want to remind everyone, thank you for coming. And please join our Slack channel. There was a link in, we got to put a link in the Zoom chat. And you can continue your Q&A there. And then our next session is going to be starting now, actually, for the networking meeting after. All right. Thank you very much, everyone.
Thank you very much for moderating.
Thank you, Tara. Yeah, if anybody's looking for the link to the
I'm looking for the link right now.
Yeah, me too.
It got lost in our
I lost track.
Sorry, I panicked.
Thank you,
No,
Tara. Katie. Thank you, Kim.
You're
As
welcome.
Oh, my pleasure. Thank you so much for joining us.
It's been a pleasure, as usual.
We're gonna do some trivia and some casual icebreakers at networking if you want to come over and have a beverage or a meal with us. We'll be
I've already
I'm gonna
poured
try
my
that
glass of
trivia.
wine in preparation.
Oh, thank you for the link. All right,
There's
the
a link.
to our-
Sorry, guys. I'm ready. I'm ready to network. Let's get this done. I'll see you in a few. Bye, everyone. Thank you.